Hello everyone, welcome back to the channel. This is Shepard's Review, and in this video we're going to talk about isotonic, hypotonic, and hypertonic. We're going to be able to distinguish the difference between each of them, and we're also going to talk about the different types of fluids and solutions that are isotonic, hypotonic, and hypertonic. So by the end of this video you should be able to identify which is hypotonic, isotonic, hypotonic, and hypertonic, and you should also be able to identify the types of solutions that are isotonic, hypotonic, and hypertonic. Before we get started on the video, please like and subscribe to our channel. It'll help with the YouTube algorithm. And having said that, let's get started with the lecture. So let's identify the terms of isotonic, hypotonic, and hypertonic. After we're done identifying the terms, we're then going to talk about what's happening to the cells or inside the cells. Because you have to understand that it's very important to know what's happening inside the cells, because when we're going to talk about the types of fluid solutions of isotonic, hypotonic, and hypertonic, we know which solutions to give to a particular disease because we know what's happening inside the cells. So let's identify it and let's talk about what's happening inside the cells. So isotonic solution means the solute concentration in the cells is the same as the solute concentration outside the cell. So this means cells remain the same. Hypotonic means lower concentration of solute in the cell compared to the solute outside the cell. So, cells swells. Hypertonic means higher concentration of solute outside the cells compared to the inside the cells. So this means cells are shrunk. So in this slide it shows here hypertonic means it shrinks the cells. Isotonic means it maintains the same size of the cells, and hypotonic means the cell swells. So let's talk about in details why this happens. So let's first start off by talking about the semipermeable membranes in our cells. So our blood cells have what is called a semipermeable membrane. So here's a drawing of the blood cells. And basically, this outer layer here is the semipermeable membrane. Now what this does is that it actually allows water to flow in, but it doesn't allow other products to flow in, such as proteins and fats. So here, water is able to go in freely, but proteins and fats are not able to go in because our body does not want other products in our bloodstream to overstuff our cells. Now the semipermeable membrane is basically a membrane that separates two solutions from each other. So let's say here that inside the membranes we have solution A. Outside the membranes we have solution B. Okay? And basically what the role that water does is that water likes to dissolve as much solute, because water is basically likes to equal each other out. So it compares which one has more solute than the other. So if the water detects that there's a lot of solute outside the cells, then water will flow out the cells to dissolve the solute outside the cells. However, if the body detects that there's more solute inside the cells, then what happens is that water will try to go inside and rush inside the cells to dissolve the solute in the cells. So water is always comparing each other to its two, trying to equal out each other so that it can be in an equilibrium state. So let's make this a little bit more simpler. As we have already discussed already, water is trying to always compare each other from the inside of the cell and outside of the cell so that it can be in an equilibrium state. Now, when the cell is hypotonic, when the solution is hypotonic, that means that there are more solutes inside the cells than outside the cells. So here, for example, when you have more solutes inside the cells, water will then rush to the cells so it can dissolve the salt, as in this case, the solute. And when water is rushing into the cells, that will cause the cell to swell. Now in the hypertonic is because that there are more solute or salt outside of the cells. So as a result of the solids being outside of the cells, there's more solute outside of the cells, the water will rush from the cell to the outside of the cells. And if water is being taken out from the cells, that will cause the cell to shrink. However, in the isotonic solutions, the solute in the cell and the solute outside the cells, they're in the same balance. So as a result of them having the same balance, they just move freely in and out. And when they move freely in and out, the cells does not shrink and it does not swell. It maintains its shape. Now that we were able to distinguish the difference between isotonic, hypotonic, and hypertonic, now let's talk about the different types of solutions for each of them. So the different types of solutions for isotonics is one of them contains 0.9% sodium chloride, and also it contains Lactaid solution. For the hypotonic solution, we have 5% dextrose in water and 0.45% sodium chloride. The hypertonic solutions, we have D10W. This is also known as dextrose 10% in water. We also have D20W and D50W. We have dextrose 5% in 0.9% sodium chloride, dextrose 5% in 0.45% sodium chloride, and dextrose 5% in Lactaid. Now let's talk about each of these solutions individually. So the isotonic solution, again, it contains normal saline, 0.9% sodium chloride, and it also contains Lactaid. Now, even though both of these solutions, they're both isotonic and they're both used for fluid replenishing and for fluid resuscitation, they are not exactly the same. There's a major difference between these two. The difference between these two is that sodium chloride, it obviously contains sodium and chloride, but this type of solution cannot be given in high volume. The pH level for this is 5.7, so it's acidic. So if we give a lot of fluids, if we give this in high volume, we can make the patient's body acidotic. However, Lactaid, we can give this in high volume. This is mostly commonly used for patients when they are undergoing surgery. And the electrolytes that they consist of is potassium, calcium, chloride, bicarbonate, and also lactate. This can also be given for patients that have sepsis, because patients with sepsis, their body becomes acidic, so this can help with the acidity level. Now, the things that we got to look out for when we're giving this type of solutions to patients, we have to look out for if they have liver disease, liver failure, or renal failure. We have to watch out for renal failure because since their kidneys are not working properly, we can actually increase their potassium level. Liver failure is because the liver is responsible for metabolizing lactate, and this obviously contains lactate. So we have to watch out for these two diseases when we're giving Lactaid. Now let's talk about the hypotonic solution. Okay, so hypotonic solution. Hypotonic solution contains 0.45% sodium chloride and also 5% dextrose in water. Now, 0.45% sodium chloride, this is basically used to help treat hypernatremia, increase sodium in the body. Now, the increased sodium in the body is caused from water depletion. It can be either caused from diuretic use, renal failure, or you're not drinking enough water. So what happens is that if you have more sodium in your body than water, what happens is that the water inside your cells in the intracellular space, it'll shift from the cells and it'll go into the extracellular space. Because sodium is a cation to the extracellular space, and when the water comes from the cells into the extracellular space, the cells will then shrink, and this is called intracellular dehydration. Now what we can do is that this solution will actually rehydrate the patient from the water depletion, and it will bring the water from the extracellular space back into the cells, and it'll maintain the cells into its normal shape or swell the cells. Now you have to watch out for cerebral edema, because rapid correction of hyponatremia can overswell the cells, causing cerebral edema. So you need to watch out if the patient is being confused, because this can be life-threatening. So the 5% dextrose in water, this also treats hypernatremia. The major difference between this is that the 5% dextrose in water contains dextrose, glucose, so it provides supplemental nutrition. And they basically are providing free water so that it can help with renal excretion of solutes in the body. So now let's talk about the hypertonic solution. So the hypertonic solution, so again we have D10W, D20W, and D50W. Now these contains no electrolytes, they're basically free water, and the main purpose of each of these IV solutions is for calorie supplementation. Treatment of ketosis from starvation, provides calories, it's free water, no electrolytes. So D20 is basically the same thing as D10. It's just that it has a higher glucose level. It also provides calories, treatment for hyperglycemia. And D50 also provides calories, but it's used for severe hypoglycemia. So this is given rapidly in IV bolus, and usually given through the central line. So another one is D5 in 0.45% sodium chloride, and D5 in 0.9% sodium chloride. So both of these solutions, they contain 170 calories per liter, and they're both used for the treatment of cerebral edema and hyponatremia. Now the causes for both these, cerebral edema and hyponatremia, it could be caused from an impaired kidney or SIAD. Now SIAD is known as syndrome of inappropriate antidiuretic hormone. This is as a result when the body is producing too much antidiuretic hormone, so it's holding the fluids. And this can also be caused from the impaired kidney. It's holding and retaining fluids. As a result of the fluids being retained in the body, this is going to cause fluid volume excess, hypervolemia, and it's going to dilute the sodium, causing dilutional hyponatremia. And as a result of the body having too much fluids, it's going to make the cells swell up. So this can cause the cerebral edema. So this solution can actually be used so that it can be able to shrink the cells, so that the fluids in the cells will leak out and go to the extracellular fluids, so that the cells can go back to its normal size. However, there are some contraindications for the solutions. We cannot give this to patients with congestive heart failure because they're already experiencing fluid overload. So we will actually worsen it. So those are the things that we have to watch out for with both D5 in 0.45 and D5 in 0.9% in sodium chloride. And the last we're going to talk about is the dextrose 5% in lactated ringer. So basically, this is a sterile solution that contains electrolytes such as calcium chloride, potassium chloride, sodium chloride, and sodium lactate in water. So this is basically an electrolyte replenisher. And again, we have to watch out if the patient has liver disease or liver failure, because the liver won't be able to metabolize the lactate well. As you can see here, this contains lactate. So basically, the dextrose 5% and lactated ringer, it still treats cerebral edema and hyponatremia. The only difference is that this just has more electrolytes than the other solutions that we talk about that are hypertonic solution. So this will be the end of the video, guys. Hope you guys liked this video. Please like and subscribe for more videos and updates. If you have any questions, please leave a comment below, or you can email me at Shepherd's Review, which I will provide in the link below that you can be able to email me. Hope you guys enjoyed the video. Until next time, I'll see you guys in the other video.